Hello, everyone. Welcome to our webinar today. This is February 25th, 2026. This is Dr. Siddharth Amber, physician here at Chicago Arthritis and Your Medicine. Today's webinar, we are talking about peptide therapy for weight loss. As I get started, please know that I'll talk for about 20 minutes, and if you have any questions, please shoot them into the chat, or if you're on one of our social sites watching, please shoot that into chat, and I will intermittently pause or pause at the end and then continue to answer. And of course, after we're done today, if you've got any other questions, you can always contact us either directly or one of our social sites, and we can talk further. Great. So today's talk, we're talking about our signature weight loss program, some of the newer peptide options that are out there, and weight loss challenges and how to handle some of those. So obesity, I think we all know the scope of this is immense, as not only a American problem, but a global problem. And its effect is on a really significant portion of the adult population and now even the child population. It affects a lot of different things, right? It affects cardiovascular health, metabolic health, immunologic health, overall well-being, increases cancer risk, and obviously affects musculoskeletal health as well. My sort of interest in this world is, number one, pretty much every patient I see has some kind of musculoskeletal issue, and a lot of my patients also have inflammatory issues as well. And so how can we help people with their metabolic health to also help with their overall joint health as well? Great. So as I've been saying, health effects of obesity are really vast. In the musculoskeletal system, they do increase rates of osteoarthritis in the knees, hips, ankles, lower back, and pains there. Obviously, cardiovascular issues, metabolic issues in terms of diabetes, insulin resistance, high blood pressure, immunologic implications. Higher or weight loss makes a big difference in terms of their inflammation, affects cancer risk, obviously sleep apnea, and other sorts of cardiovascular issues as well. Weight loss solutions, because it's such a massive issue, obesity and metabolic health, we have really a public health duty to try to improve things. Diet and exercise are essential, but they're hard for most people as a only solution. So conventional weight loss strategies often lead to really unsustainable results, or a yo-yo effect, where people are losing weight, gaining weight, losing weight, gaining weight. And we've come to realize that weight loss is not just it's not a moral issue, right? It's a biological issue, it's a medical issue. And there's a very complex interplay of biologic, psychological, environmental factors that are involved. And we need to take modern medicine and science and utilize them to our advantage. So we're talking about our physician-assisted weight loss program to overall help with weight loss, as well as all the other weight-related issues. Goals are to not only reduce weight, but to improve body composition, reducing fat, maintaining or improving muscle mass, reducing visceral fat, which has such a tight correlation with metabolic and cardiovascular issues. And then, of course, improving cardiovascular risk factors, improving metabolic risk factors, improving exercise capacity, improving eating habits, improving immune and gut health, improving stress and sleep management. So there's three ways that diet can help with weight loss. The first is you can just eat less calories in total, right? If your output, meaning your energy consumption, is greater than your input, your intake of food, you will get weight loss. And then you can eat different types of foods, right? Eat less of specific foods should help with weight loss. The problem is which foods. So if you look in the general public, you'll see that there's people who do everything from it's such extreme. I know people who do vegan no oil to people who do fully only carnivore. So you have such a wide stretch of what humans as omnivores do, which foods. And a lot of it varies from person to person, depending on your own particular genetics and what seems to affect your body. And then there's eating only specific periods of time, right? That's called intermittent fasting. So intermittent fasting, 16-18, the classic is that you basically fast for 16 hours of the day. You eat between 10 a.m. to 6 p.m. And those are the only times you eat. Outside of that, you're not eating. There's some benefits to that as well, namely that probably eating late at night is not a great thing. In terms of how your body processes sugar. For anyone that's ever had a CGM, continuous glucose monitor, you can tell that when you eat later at night, that blood sugar stays high later than you'd want it to. And there may be some benefit to even not eating right off, a nice, easy way of getting some of the benefits of fasting without really being too overly onerous. So all these are helpful. It's hard to pick out which to use, but some of the tools that we have now with GLP-1 agonists can actually help do all of this. So peptides are naturally occurring molecules in our body that molecules. That means is that the peptides emphasize pathways in your body. You can use this in a way where you can minimize pathways that are problematic. It's clearly the future of medicine. There's aspects of it that are already available. The best known ones are the GLP-1 agonists, which is what we're focused on today. So GLP-1 agonist, glucagon-like peptide, this will regulate appetite, increase insulin secretion, and energy metabolism. There's other targets around this as well. Semaglutide is the medication that affects GLP-1. Tirzepatide and retatrutide are versions that affect not only GLP-1, but other targets as well. Tirzepatide is already available. Retatrutide is in the process of possibly being approved later on this year. This molecule, this peptide, has a key role in your blood sugar control and insulin secretion. And as such, it has a key role in blood glucose and thus diabetes and thus also metabolic health. So semaglutide is the initial GLP-1 agonist. You've probably heard this in other names as well, including Ozempic and Wegovy. Tirzepatide is the brand name is Zepbound. They have tremendous benefit approved for two different realms. Right now, approved in treating diabetes, and then also in treating chronic weight management as well. The data in both those spheres is really remarkable. So in treating diabetes, really just absolutely amazing what it's done for reducing diabetic needs for insulin. And in weight management, it's approved in people who have a BMI of over 30, but also people with a BMI over 27 who also have other weight-related comorbid conditions. And it's a wide range of things, including high blood pressure, diabetes, cholesterol, if you already have osteoarthritis, fatty liver, if you've ever had pre-diabetes, heartburn, PCOS, hypogonadism, and asthma. The exciting thing about this class of treatments is that you can very quickly start to realize, based on the data that's coming out, that improving your metabolic some evidence that for folks who have Alzheimer's who are also taking, and so that's why people fall, even in the autoimmune spectrum, is comparing their patients who have taken an anti-IL-17 med who got psoriatic arthritis, and their patients who've taken that same medication along with a GLP-1 agonist. And the difference is that because of weight loss, they respond so much better to the treatment as well, their psoriatic arthritis treatment. So there's such a interesting connection between metabolic health and inflammation that we're just realizing. Future of autoimmune conditions, in part, will actually be treating metabolic disease, their metabolic connections, so that you can treat their inflammation, so you can prevent their heart disease. And that is the potential future, which is pretty exciting. These treatments, semaglutide, tirzepatide, they work through a very interesting brain and gut reaction or axis. To begin with, it slows down your stomach emptying. You have reduced hunger sensations. It basically turns that sort of hunger switch or hunger chatter. It kind of turns it off or minimizes it. Helps people feel fuller sooner, because it turns out that sensation of not only hunger, but feeling like you need to eat because you're not full is dictated by peptides. And so it reduces food cravings, even food preferences. The preference for bad foods is reduced, and even thoughts for food. That's how it helps from like a eating standpoint. It helps from the metabolic standpoint by allowing your cells to basically process blood sugar a lot faster and more efficiently. All of that is what improves not only weight loss, but metabolic health, and then everything else that comes from that. Let me just pause for a moment. So in terms of dosing, GLP-1 agonists currently are a weekly self-injectable treatment. You start on a low dose, you escalate monthly as needed. You monitor your weight, appetite, observe for any side effects. I'd recommend getting your basic metabolic health labs every 6 months. If you're diabetic, probably need it more frequently, probably need it every 3 months to make sure things look okay. The results are very compelling. For semaglutide, there's on average about a 15% weight loss at the 1+ year mark. For tirzepatide, it's more like 20%, and those results are maintained as long as you stay on treatment. The keys here are to try to maintain this or to combine this with good nutrition and regular exercise to maximize results, and to do this healthy and to maintain healthy habits long-term as well. Side effect profile is relatively mild when you think about how profound these treatments are. Most common side effects are GI in terms of nausea and constipation. There are some rare, more severe GI side effects. If you're someone who has diabetes or pre-diabetes, you have to keep an eye on your blood sugar if you're already on other medications so that you're not lowering it too fast. If you're some of the challenges with GLP-1 treatments are as follows. For folks who are having intolerance, again, the biggest intolerance is GI in terms of nausea. A couple of things. Number one, definitely speak with your physician. You can try adjusting your dose. That can mean reducing the dosage that you're taking. I personally think that we probably, for folks who are getting like a standard dosing, I think they probably get, it's such a high dose, right? Like all at once, there may be some benefit to even splitting the dose over the week. That can be hard if you're getting this through kind of a traditional dosing mechanism. You may need to get that through a compounding pharmacy, but there may be some benefit to sort of reducing the dosage, but getting the full dosage over the week, if that makes sense, splitting it up. You can also try a different GLP-1 agonist if you're having difficulty with semaglutide or Ozempic or Wegovy because of nausea. Tirzepatide, because it affects two different peptides, it seems to have less nausea side effects with that. So I think that's a good option. There's milder options. There's lipotropics, which we'll talk about. There's even maybe other peptides to consider as well. And what are some of the risks associated with that? We'll talk about that. If you find you're not losing enough semaglutide, there's a couple things. Have to maximize exercise, have to maximize nutrition. Some of this sounds obvious, but it should be said that when you're trying to improve weight and metabolic health, you should really be trying to maximize your lifestyle options as well. The kind of exercise you do makes a big difference in terms of weight loss. The way that you eat makes a big difference. the nice thing about a treatment like the GLP-1 agonist is that, in particular for food, I think most humans have potential issues with food. There's naturally preferences that you develop just based on what you grew up eating, all the social factors that come with eating as well. And some of those can be problematic. And so, the nice thing is that the GLP-1 agonists help to reduce some of that kind of connection, where maybe we get a little too addicted to certain types of food. And it can help to reduce that, and it gives you a chance to improve your nutrition and dietary habits. And then, definitely look what other medications are you taking? Is there anything else that can cause weight gain? Because there are some medications that can do that. I think also you should think about, if you're, are there other aspects of your health that can be managed as well? Let's say hormone health as well. For both men and women, as we get older, our hormone health gets affected. Our ability to manage our metabolism, manage our overall health gets affected because of that. That may be an avenue that should be improved or supplemented. And then, of course, if you're not losing enough weight, it may be because you're in too low of a dosage. Maybe you need to escalate dosing. Or again, maybe you need to try different GLP-1 agonists like tirzepatide. And then I think in the future, it'll be also about, should we be combining it with other options as well that work as peptides as well. Some other options, there's lipotropics. Lipotropics are basically a shot of various supplements and amino acids. There's a lot of benefits to these. They may help with not only energy, they can also help with kind of milder weight loss. This is not as strong as, let's say, a GLP-1 agonist, but as a augment or as an addition, I think it can help as well, and is a very low risk way of trying to improve things. Again, this is given as an intramuscular injection. You inject yourself once per week. Low risk, because they don't really have anything that's going to be, unless you're allergic to anything that's in it, which would be pretty rare because most of these are just vitamins. Generally very low risk of reactions and can be helpful. I think health coaching is part of this as well. We work with a company called Revolution Physical Therapy and Weight Loss. They do a great job in terms of nutrition and health coaching. There's this understanding that when it comes to creating new habits, I think especially when you're talking about exercise and nutrition, when you're trying to create new habits, it can take 60 to 90 days of consistent effort. Part of that is education, knowing what's right, what's not right. I think with food, I think sometimes we think we know what's right, but there's so much just nonsense information out there as well in the world that sometimes we don't know what's right really for us. So I think education through working with a nutritionist can be very helpful. I think accountability with health coaching can be very helpful as well. Long term, the goal is to keep you healthy. It shouldn't just be that you're taking an injection. It should be that you're doing everything else correctly as well. I think the keys to optimized treatment are to take the right treatment in terms of peptides, doing the right sort of nutrition and the right exercise. When it comes to exercise, it really should be partly cardiovascular exercise to help out with weight loss, improve metabolic health, but also strength training to also help protect from muscle loss. The issue with GLP-1 agonists or any weight loss treatment for that matter is that your body will pull from not just fat, but also muscle as well. And in order to do this safely, you should be thinking about doing the right foods and exercise to maintain your muscle mass as well. There are other peptides out there. I'm always hesitant to talk about these because there is a lot of anecdotal evidence that these can be helpful, but there's not a lot of sort of clinical testing that's out there. And some of these are off-label. Some of these are very hard to get. Some of these can only be gotten through compounding pharmacies. The ones that have been most tested are the ones that work on the growth hormone axis. There may be some benefit to this. If you're using any of these, you really need to be using these with, I think, very close physician supervision. Some of these, it's probably okay to use short term, and then you take some time off and maybe start it again. You may need to be appropriately monitored to make sure you're not developing any other side effects as well. So, these are all medical treatments, whether you're talking GLP-1 agonists, some of the other peptides. They can be helpful. You just have to do them in a safe and appropriate manner. So GLP-1 agonists, when it comes from a safety standpoint, these have been studied for years. I think literally Novo Nordisk, I think, had started looking at GLP-1 agonists, I think, over 20 years ago, right? So like there's a slow process where this finally got marketed and eventually introduced to the general public. But these are being obsessively looked at, and generally low risk, right? And generally safe if used under medical supervision. But as with everything, if you're giving hundreds of millions and eventually billions of people this kind of treatment, there will be some potential side effects. So please work with a physician that knows who knows your medical history well and can manage these things appropriately. Besides that, I'd always recommend start slow, start low, and slowly escalate as needed. Some of the other peptides, not as well studied. If you end up going that route, please work with, again, a physician that knows what they're doing and can conservatively get you through this appropriately. Again, some of these have very good published evidence, some less published evidence, but they have good physician experience. Be cautious if you have other medical issues, because that always adds an extra layer of complexity that your physician should be comfortable with. Understand that some of these need intermittent dosing and stopping. Some of these you should be on long-term. So GLP-1 agonists, you should probably be on long-term. That's where the data is. In terms of combining peptides, I think this is interesting. I think the future, hopefully, would be utilizing something like GLP-1s or some version of that to help out metabolically and with appetite, and then utilizing other peptides to help out, kind of preventing weight loss and helping out in other pathways as well. I think that is the future. Not sure if we're quite there, but I think at least for now, I think combining this with healthy nutrition, regular exercise is the way to go. Regulatory, you're going to be hearing a lot more about regulatory issues always. GLP-1 agonists, I mean, trust me, pharma is looking at what else can we use this for, and they're thinking about this a lot. I think eventually you'll start to see GLP-1 agonists, their indications will expand. Right now, their indications are actually pretty broad. When you talk about weight loss, it includes a lot of other obesity-related complications. That is a huge number of things. And I think over time, pharma will keep on adding to that list, which will make it more available to more people if we can afford it in this country. So compounding pharmacies, you'll hear more and more about this. This is a fluctuating area. It can be hard to get these if you don't meet the exact criteria. If you've got diabetes, if you meet the right criteria, getting treatment is possible through your insurance. If it's primarily for weight loss, it can be a lot harder, right? Just because insurance does not want to pay for this. And so if you're using a compounding pharmacy, please make sure your physician is aware of that this is a dynamic process and things are in flux, and they know how to keep you safe through this process. If you lose access to your peptide therapy, you have some options. Pharma's trying to create some avenues where people can buy this directly at more reasonable costs, meaning instead of $1,200 to $1,500 per month, can you get it for $500 to $600 per month, right? That's actually pretty reasonable. Who knows what will happen from a federal government standpoint, right? But I think pharma is already trying to respond for folks who have to go cash pay for this. I doubt they're going to be able to push through significant discounts from an insurance standpoint. I think that's more complicated. If you're going through compounded pharmacy, that is an option, right? If you lose your access through your pharmacy benefits. Again, there are maybe other peptides to consider short-term usage. And then always remain patient. Your peptide may come back online, and you may be able to get it again. Some frequently asked questions, right? People will ask, how long will it be before they can see weight loss? Again, you may see early weight loss at the first month, but really you have to give it a good 6 months. You should be starting low, slowly increasing. That's the safe way to do this. On average, Most patients will lose 15 to 20% after 1 year. How long do you have to continue on this? Realistically, give it at least 6 months to begin with to see how well you're going to do. The data for weight loss really is that people are on this long term. Now, that might mean you hit a reason. Let's say you hit your goal of weight loss and health. You may end up staying on a lower dosage or frequency. That probably makes sense. I think in the future, we'll probably be doing a lot more microdosing of this. You'll probably hear about that more and more over time, where you're not necessarily on a high therapeutic dosage. Maybe you're on a lower maintenance dosage. I think that actually has probably a lot of benefits. It makes sense. I've seen that work. It's an odd question, but I've had somebody ask me before, do they need to eat healthy and exercise when they're taking these treatments? Of course, you should be doing that no matter what. But you should definitely be doing this if you're trying to lose weight. It'll give you a more optimal result. Can these treatments lead to muscle and bones weaker? Can it lead to muscle loss and bone loss? If you're doing a GLP-1 agonist, yeah, that is possible, because again, your body does not know whether to pull from fat or muscle. So you have to be focused on body composition. That means doing the right kind of food and doing the right kind of exercises. In the future, combining with other peptides will be interesting. Another question I've heard somebody ask, they already don't eat much, will treatment still help? This is an interesting question. And the reason why is because if you think about how these treatments work, it's not just by an appetite suppressant. It does help on a metabolic level. It helps your body, which over time, unless you have type 1 diabetes, for most other people, as we get older, our body loses a efficiency in our metabolic health. That's what leads to slowly increasing blood sugars as we get older, slowly increasing blood pressure, cholesterol, eventually heart disease, eventually neurodegenerative issues, all these things. It's because our body loses that efficiency that we have when we're younger. And in large part, these treatments help because they help your body function more efficiently from a metabolic level. And so, yes, these treatments can still help even if you don't eat a lot, because they help in that regard. If you already don't eat a lot, you probably don't need to be in a high dosage, right? You probably need to be in a lower dosage, and you'll still get some benefit from not only a weight loss standpoint, but metabolic standpoint also. What happens if you stop treatment? So it's actually been looked at with semaglutide. If you just cold turkey stop the treatment and you stop doing any sort of other healthy behaviors, eventually 2/3 of the weight loss is possible. Emphasizing maintaining your good nutrition and exercise, and think about maintenance dosing longer term. Again, whether that is low dosage or less frequency dosage, that probably would be helpful. Lastly, how do peptides compare to other prior weight loss treatments? I mean, the GLP-1 agonists are revolutionary. They not only lead to more weight loss, they're definitely safer as well. Some of the other prior treatments that are still used can be beneficial, but nothing works quite as well or as efficiently or as safely as a GLP-1 agonist in most people. A little bit about how we're utilizing GLP-1 agonists when it comes to weight loss specifically. We are essentially, this is physician managed. Our team is managing this. Keep a close eye on your labs. Make sure that we're doing this properly and correctly in the right people. For what it's worth, we've also utilized this in some folks who are trying to get some metabolic effect for their inflammatory conditions as well. And I think there is some value to that in some people. Keeping a close eye and doing this safely for you and in you, and keeping an eye on your labs and how you're responding to make sure that this is done safely and appropriately. To learn more, check us out, chicagoarthritis.com. There's our QR code, CAPTCHA. I can't remember which one it is, but you can take a picture of that and contact us anytime if you'd like to learn more. Let me pause for a second and see if there's any other questions. Okay, I don't see any additional questions from social media. Let's see if there's any questions through Zoom chat. Don't see anything. Wonderful. Thank you, everyone, for your time today. There'll be a replay of this that you can watch later on. And if you have any other questions, please let us know. We're here to help and to educate. Thank you, everyone, for your time. Until we connect again, have a good day and live well. Bye-bye.